Hello everyone, so this is Jyoti Beniwal, your Nclex trainer, and today we are going to solve some more questions of gynecology. So let's start. After circumcision with a plastic belt, the nurse should instruct the neonate's mother to cleanse the circumcision site using which agents? So you have four agents and choose the right option. What can be the correct one? So we should cleanse with warm water. Next question. Based on the understanding of periods of reactivity, what should the nurse encourage the mother of a term neonate to do approximately 19 minutes after the birth? Read all the option. What can be the right answer? So after 90 minutes of the birth, the neonate typically at the rest or sleep phase. So we have to let the neonate to sleep, and answer number 2 will be the correct response. Next question. The nurse is to assess a newborn for in curving of the trunk. Which illustration indicates the position in which the nurse should place the newborn? Okay, so these are the position on which position we can check. So here are four positions you can see. So which position is best to check the incurving of the trunk? So choose the right response. So incurving curve को हम assess कर रहे हैं trunk पे. So this is an autonomic reflex. So इसके लिए हमको infant को horizontally place करना है prone position में with one hand and stroke the side of newborn trunk from the shoulder to the buttocks using another hand. So if this reflex is present, the newborn trunk curves towards the stimulated side. So this will be the correct response. Now let's read the next question, that is 20. A full-term neonate is admitted to the newborn surgery center. When lifting the baby out of the crib, the nurse notes the baby arms move sideways with the palm up and thumbs flexed. What should the nurse do next? So you have four options on the screen and let me know the correct one. So this is normal Moro reflex. So no intervention is used. Second will be the right one. Identify this reflex as a normal finding. Now next question, that is 21. After the birth of a neonate, a quick assessment is completed. The neonate is found to be apneic. After quickly drying and positioning the neonate, what should the nurse do next? सो द बेबी को एपनिया था, उसके बाद ड्राई भी किया एंड पोजीशन भी दिया. सो उसके बाद नर्स को क्या करना चाहिए एपनिया को ट्रीट करने के लिए? सो द नर्स शुड स्टार्ट पॉजिटिव वेंटिलेशन. सेकेंड विल बी द करेक्ट रिस्पॉन्स. Next question. A 6 lb neonate was born vaginally at 38 week of gestation. At 5 minutes of life, the neonate has following sign like heart rate is 110 beats per minute, intermittent grunting is there with respiratory rate of 70 breaths per minute, placid tone, no response to stimulus, and overall pale white in color. What is the Apgar scoring? Choose the right one. क्या स्कोर होगा अपगार का? सो हार्ट रेट 100 से ज़्यादा है, से 2 पॉइंट्स मिलेंगे. रेस्पिरेटरी रेट 70 ब्रीथ्स पर मिनट है, उसके भी 2 पॉइंट्स मिलेंगे. एंड द फ्लैसिड मसल टोन 0 मार्क्स एंड लैक ऑफ रिस्पॉन्स टू स्टिमुलाई ऑल्सो इक्वल्स टू 0. सो द आंसर विल बी 3. 4 पॉइंट्स मिलेंगे एबगार स्कोरिंग में. Now next question. The neonate has large amount of secretions after vigorously suctioning the neonate. The nurse should assess which possible result. Vigorous suction के बाद क्या हो सकता है neonate को? What can be the right response? So because of potential vagus nerve stimulation, the baby can go into bradycardia. So vigorous suction के बाद bradycardia को monitor करना है. First will be the right response. Now next question 24. After vaginal birth of a term unit, the nurse observed that the unit has one artery and one vein in the umbilicus cord. The nurse notifies the HCP based on analysis that may be indicative of which abnormalities. Choose the right response. नॉर्मली अम्बलाइकस कोड के अंदर टू अम्बलिकस आर्टरी होती है और वन वेन्स होती हैं. So this is abnormal, so it will indicate some cardiovascular abnormalities. Now next question. While changing the neonate's diaper, the client asked the nurse about some red tinged drainage from the neonate's vagina. Which response would the most appropriate? किसी भी फीमेल बेबी को अगर रेड स्पॉटिंग दिखती है आफ्टर विजाइनल बर्थ, सो व्हाट कैन बी द राइट रिस्पॉन्स? Third will be the correct answer. Sometimes baby girls have this hormone like estrogen received from the mother. So mother से estrogen अगर baby receive करते हैं तो increase in the level of estrogen can cause vaginal bleeding. So this is normal, not a risk. Which finding would the nurse expect as common for multiparous client giving birth to a viable neonate at 41 of gestation add of a vacuum excretor? So vacuum delivery हो रही है and 41 weeks पे हो रही है. So कौन सा रिस्क हो सकता है? Choose one option. So you have four options. Caput succedaneum is the right response. Swelling edema हो सकता है हेड पे प्रेशर की वजह से जो सक्शन प्रेशर लगा था. Now next question. After explaining to a primiparous client about the causes of neonatal cranial molding, which statement by the mother can indicate need for further instruction? So you have four options. कौन सा ऐसा ऑप्शन है जिसमें फर्दर इंस्ट्रक्शन की जरूरत पड़ सकती है क्रेनियल मोल्डिंग को लेकर? Brain damage may occur if the molding does not resolve quickly. So fourth one will be the false statement and need further instruction because cranial molding during vaginal birth हो सकती है जो कि कुछ टाइम के बाद अपने आप resolve हो जाएगी. So no risk. Now 28th question. Which observation is expected when the nurse is assessing the gestational age of neonates born at term? So we are talking about expected observation. So which will be the right response? Sole creases covering the entire foot is the right answer, and this is the normal finding of a normal neonate. Now next question 29. While the nurse is performing a complete assessment of a term unit, which finding would alert the nurse to notify the HCP? So what will be the right response? That we need to share with the HCP. That is expiratory grunting. So ये respiratory distress को indicate करता है. So अगर respiratory grunting है पीडिया के अंदर स्पेशली, so वो high risk पे है, बेबी को respiratory distress हो सकता है. So we have to share this finding with the healthcare provider. Now next question 30. Which instruction, after instructing a mother about normal reflexes of a term unit, the nurse determines that the mother understands the instruction when she describes a tonic neck reflex as occurring when the neonate displays which behavior? So it's about tonic neck reflexes. So choose the right response. Third will be the correct one. turn head to the left, extend left extremities and flex other extremities. So ये reflex कुछ महीने के बाद disappear भी हो जाती है. Now next question 31. A primiparous client expresses concern asking the nurse why her neonate's eyes are closed. Which information should the nurse include when teaching the mother about neonatal strabismus? So क्या reason होता है neonatal strabismus का? Choose the right response that the nurse can tell the mother. So neonates commonly lack eye muscle coordination that can cause neonatal strabismus. Next question. While performing a physical assessment on a term neonate shortly after the birth, which finding would cause the nurse to notify HCP? कौन सी finding हम HCP को बताएंगे? Choose the correct one. Single crease on each side of palm that indicates some chromosomal abnormalities. So ये हमको HCP को बताना है, शेयर करनी है ये finding. So third will be the correct response. Now next question. Metabolic screening of an infant revealed a high phenylketonuria level. Which statement by the infant mother indicate understanding of disease and its management? Select all that apply. So the question is about phenylketonuria and you have to choose more than one options. Answer number 1 will be the correct. 5 and 6 will also be the correct. Now next question 34. Assessment of a term neonate at 2 hours after birth revealed heart rate less than 100 beats per minute, periods of apnea approximately 25 to 30 seconds in length and mild cyanosis around the mouth. The nurse notifies the HCP based on interpretation that these findings may lead to which condition. So choose the right one. So all these findings are associated with respiratory arrest. So this is a very serious condition. So one first will be the right response. Now next question. A new mother asks, when will the soft spot near the front of my baby head closes? Which should the nurse tell the mother about soft spot will close? Choose the right response. You have 4 options. सो एंटीरियर फोंटेनले क्लोज जो होता है वो 12 से 18 मंथ्स के बीच में हो जाता है एंड इफ यू टॉक अबाउट द पोस्टीरियर फोंटेनले दैट विल क्लोज बिटवीन 2 to 3 मंथ्स. सो जो फ्रंट हेड का होगा दैट इज फ्रंटल एरिया राइट. सो राइट आंसर विल बी 12 to 18 मंथ. सो एंटीरियर फोंटेनले 12 to 18 मंथ्स के अंदर क्लोज हो जाता है. Which assessment finding in a term unit would cause the nurse to notify HCP? Which finding we should consider serious and we have to tell the HCP about that finding. Choose the right response. The right answer will be unequally sized cornea. That is because of some congenital glaucoma. So we have to share this finding with the HCP. Next question 37. At 24 hours of age, assessment of a newborn reveals the following. Eyes closed, skin is pink, no sign of eye movements, heart rate is 120 beats per minute, respiratory rate is 35 beats per minute. What is the neonate most likely to experiencing? So all these findings are not dangerous. So what can be the right answer? Choose the right one. So it indicates a state of deep sleep. So third will be the correct response. Now, next question. While assessing a male neonate whose mother desires him to be circumcised, the nurse observed that the neonate's urinary meatus appears to be located on the ventral surface of the penis. The HCP is notified because the nurse suspects which complication? When the urinary meatus appears on the ventricle surface of the penis, that can indicate what? That is hypospadias. Next question 39. The nurse is discussing kangaroo care with the parent of a premature neonate. The nurse should tell the parents that the advantage of skin to skin include which benefits. So kangaroo mother care के क्या क्या benefits हो सकते हैं? It's a starter question and you have to select more than one response. So choose the right ones. Four and fifth will be the correct response. That will enhance the bonding, improve psychological stability, decrease the length of stay in the neonatal intensive care unit, and improve breastfeeding will be the correct response. Next question. After a vaginal birth, the preterm neonate is to receive oxygen via a mask. While administering the oxygen, the nurse should place the neonate in which position? Which position is best to ventilate the lungs and expand the lungs and improve oxygenation? So choose the right response. Fourth will be the correct answer, that is back with neck slightly extended. Next question. Which action should the nurse take when performing external chest expressions on a neonate born at 28 weeks of gestation? If we talk about CPR, we give the CPR in neonates with our two fingers or a thumb. So we have to maintain a compression to ventilation ratio, that is 3:1. साथ साथ में कंप्रेशन के साथ साथ हमको वेंटिलेशन भी देना है, ऑक्सीजनेशन भी देना है ताकि लंग्स एक्सपैंड कर सकें. Next question. A preterm unit who has been stabilized in a place in a radiant warmer and is receiving oxygen via an oxygen hood. Which action should the nurse take while administering oxygen in this manner? So we cannot provide dry oxygen and we have to make sure the oxygen is humidified before transferring to the neonate. So first will be the correct response. Next question. 2 hours ago, a neonate at 38 weeks of gestation weighing 7 lb was born to a primiparous client who is tested positive for beta hemolytic streptococcus. So mother infected him. Which finding would alert the nurse to notify HCP? So the mother is infected and the bacteria can also transmit it to the child. And if the baby's temperature is elevated, that is temperature instability, that may be an indicative of sepsis or infection. So answer number 3 will be the correct response. Assessment of a 2-day-old neonate born at 34 weeks of gestation reveals absent apical pulse left to mid-clavicle line, cyanosis, grunting and diminished breath sound. After beginning oxygen, which is the priority intervention? Oxygen is transmitted, then we should go for X-ray to ensure what? Choose the right response. न्यूमोथेरेक्स भी हो सकता है बेबी को, सो वी हैव टू मेक श्योर कि हम चेस्ट एक्सरे एक बार करा लें बिकॉज ऑल दिस सिम्टम्स आर इंडिकेटिंग ऑफ न्यूमोथेरेक्स. नेक्स्ट क्वेश्चन. 24 hours after a cesarean birth, a neonate at 30 weeks of gestation is diagnosed with respiratory distress syndrome. When explaining the parents about the cause of this syndrome, the nurse should include the discussion about an alteration in the body secretion of which substance. So क्या substance अगर कम हो जाता है, ज़्यादा हो जाता है, जिसकी वजह से रेस्पिरेटरी डिस्ट्रेस सिंड्रोम हो सकता है, डैट इज लंग्स सर्फिकेंट। अगर वो डिक्रीज हो जाए, डैट कैन लीड टू रेस्पिरेटरी डिस्ट्रेस सिंड्रोम। सो आंसर नंबर 2 विल बी द करेक्ट रिस्पॉन्स। Now next question, a viable neonate born to a 20 or 28-year-old multiparous client by a cesarean birth because of placenta previous diagnosed with respiratory distress syndrome. Which factor would the nurse explain as a factor placing the neonate at greater risk of this syndrome? So respiratory distress syndrome का risk कब होता है? जब neonate preterm होगा. So answer number 2 will be the correct response. Next question 47. While the nurse is caring for an neonate at 32 weeks of gestation in an isolate with continuous oxygen administration, the mothers ask why the neonate oxygen is humidified. What should the nurse tell the mother about the humidification of oxygen? Answer number 3 will be the correct response. Oxygen is drying the mucous membrane until it is humidified. Next question 48. A preterm neonate is admitted to a neonatal intensive care unit at about 30 weeks of gestation, is placed in an oxygenated isolate. The neonate mother tells the nurse that she was planning to breastfeed the neonate. Which instruction about the breastfeeding would be most appropriate? So choose the right response. फोर्थ विल बी द करेक्ट रिस्पॉन्स, दैट इज गैवेज फीडिंग यूजिंग ब्रेस्ट मिल्क। तो मदर को पहले ही बोलेंगे आप ब्रेस्ट मिल्क को स्टोर करें। दैट कैन बी गिवन अंटिल द न्यूनेट कोऑर्डिनेट सक्शनिंग एंड swallowing। तब तक वो सकिंग एंड swallowing नहीं सही से कोऑर्डिनेट कर सकता, सो वी कैन गिव दैट मिल्क। Next question, that is 49. What is the best reason for assessing a neonate weighing 1500 gram at 32 week of gestation for retinopathy of prematurity? You have 4 options on the screen and choose the right one. So this retinopathy of prematurity are associated with many risks, like including like high atrial pressure, oxygen can be there, and prematurity can be there, low birth weight can be there. So बहुत सारे risk factors इसके अंदर होते हैं. So the answer number 1 will be the correct response. Next question 50. Which subject should the nurse include when teaching the mother of a neonate diagnosed with retinopathy of prematurity about possible treatment and complication? So what is the possible and best treatment in prematurity of retinopathy? That is laser therapy. Next question. 3 days after admission of a neonate born at 30 weeks of gestation, the neonatologist plans to assess the neonate for intraventricular hemorrhage. The nurse should plan to assess the neonatologist by preparing the neonate for which test? So this is intraventricular hemorrhage. So ventricles जो होते हैं ब्रेन्स के, वहाँ पर अगर hemorrhage है, so what should we assess? Cranial ultrasonography should be there. So answer number 1 will be the correct response. Next question, that is 52. Which finding would the nurse most expect to find a neonate born at 28 week of gestation who is diagnosed with intraventricular hemorrhage? That is bulging fontanelle. So bulging out हो जाएगी fontanelles की. Next question. An infant born premature at 34 weeks is receiving gavage feedings. The nurse Holding her infant asks why the nurse places a pacifier in the infant's mouth during these feedings. The nurse should reply that the pacifier helps in what ways. So क्यों हम pacifiers दे सकते हैं? What can be the right answers? Encourage sucking behavior will be the right response. What else? Improve weight gains and instilling a calming effect and improve digestion will be the correct response. While the nurse is caring for a neonate born at 32 weeks of gestation, which finding would most suggest that the infant is developing necrotizing enterocolitis? Choose the right response. सो नेक्रोटाइजिंग एंटेरोकोलाइटिस जीआई की काफ़ी ज़्यादा अफेक्ट करती है हमारे गैस्ट्रोइंटेस्टिनल एरिया को एंड दैट विल ऑल्सो कॉज सम एब्डोमिनल डिस्टेंशन सो फोर्थ विल बी द करेक्ट रिस्पॉन्स which statement by the mother of a neonate diagnosed with bronchopulmonary dysplasia indicates effective teaching about this condition? So you have four options and choose the right one. So this is a chronic illness that may require prolonged hospitalization and permanent ventilation. So what can be the right response? Second will be the right response. My baby may require long-term respiratory support in this condition. So next question, a preterm infant born 2 hours ago at 34 weeks of gestation is experiencing some rapid respiration, grunting, no breath sound on one side and a shift in location of heart sound. The nurse should prepare to assist with which procedure? Four options are there and choose the right response. So all these findings indicate pneumothorax. So pneumothorax के अंदर जो lungs है उनके अंदर air चली जाती है. So we can insert the chest tube to remove all the excessive air from the lungs. Fourth will be the correct response. Which finding would lead to nurse to suspect that neonate born at 34 week of gestation receiving intravenous fluid has developed overhydration. So जब overhydration होता है तो क्या findings आ सकती हैं? हाइपोप्रोटीनीमिया, प्रोटीन्स का लेवल डिक्रीज हो जाता है अगर हम ओवरहाइड्रेटेड होंगे. A newborn weighing 6.5 lbs to receiving naloxone due to respiratory depression as a result of narcotic given by the mother shortly before birth. The drug is to be given 0.01 mg per kg to the umbilical vein. The vein is marked 0.4 mg per ml. How many milligrams would the newborn receive? So, कितने मिलीग्राम्स रिसीव करेंगे? कैलकुलेट द ड्रग. So the weight of the baby is 2.95 kg and the dose given is 0.01. So multiply that. So the answer will be 0.029. So round off करके कितना आएगा? 0.03 mg will be the correct response. Next question. After plotting a postterm unit weight and length on a growth chart, the nurse determines that the infant is large of gestational age. Which laboratory value is most important for the nurse to assess next? Baby अगर large है तो we have to monitor blood glucose level क्योंकि अगर मदर को गेस्टेशनल डायबिटीज़ होती है उस कंडीशन में लार्ज वेट बेबी का ज़्यादा वेट होता है तो ऐसे बेबी बोर्न होते हैं. सो वी हैव टू मेजर द ब्लड ग्लूकोज लेवल एंड जिन मदर को गेस्टेशनल डायबिटीज़ होती है उनके बेबी तब बोर्न होते हैं उनको हाइपोग्लाइसीमिया होता है फॉर सम टाइम. सो वी हैव टू मेजर द ब्लड ग्लूकोज लेवल ऑफ द इन्फेंट ऑल्सो. Next question. A neonate born by cesarean at 42 weeks of gestation weighing 4.1 kg with Apgar scoring of 8 at 1 minute and 9 at 5 minutes after the birth develop and increased respiratory rates and tremors of the hands and feet 2 hours postpartum. Which is the priority problem for this neonate? So increased respiratory rate and tremors are indicative of hypoglycemia. Fourth will be the correct response. So this was all about this question, and we are going to discuss some more question in our another class.